Samantha Martinelli. Now, Samantha is 14?
13.
13 years old. And what's your rank in the country?
Right now, it's 50, but I used to be number 4.
Okay. You used to be the 4th ranked tennis player in the country until you developed, was it a rib and shoulder problem?
Yeah.
And you saw me for, well, about 3 months ago. And that's probably why it dropped.
Well, I actually aged up.
Oh, you aged up?
From the 12s to 14s.
Okay, okay. But she's on her way to a professional tennis career. And she goes to Vegas and plays in Vegas and kind of lives in Vegas too sometimes.
Yeah.
It's a very serious business. It's one of our future superstars. But when she first came to see me, I think it was your shoulder, wasn't it? And she had been to many doctors on all kind of therapies. Am I correct? Mm-hmm. And nothing was working, and you figured your tennis career is over. Yeah. All right. But now your tennis career is doing good.
Yeah.
Okay. And she had a shoulder problem, and she was treated for how long were you treated for your shoulder problem?
One time.
I mean,
before?
Yeah.
Oh, like 2 months. I just didn't play for 2 months.
And what kind of treatment were you getting?
Just icing it, mostly.
Physical therapy type of
doing
stuff?
some band work, that kind of stuff.
Going to physical therapy?
Yeah.
Yeah. Okay. And so somebody said, go see Dr. Vetanze. So this was one of the cases where I said earlier that she's having shoulder pain, but it's not the shoulder. This is, at that time, a 13-year-old girl, young lady. Come on. You're not supposed to have shoulder problems when you're 13 years old, girl or boy, okay? You're supposed to have no pain, all right? If you're healthy, you have no pain. So her mother and her came in, and I checked her out. I said, the shoulder's fine. It's the rib. So with Samantha, okay, I palpate the clavicles. You don't mind being on TV, do you?
No.
Okay, take a look, everybody. This is a star. All right, fine. Okay, and it was the right side, and it's the second rib. Now, recently, she just came back from Vegas. You had been out there for several months?
A few weeks.
Few weeks? Mm-hmm. All right. And her shoulder started acting up again. So she comes in to get treated, and she's going back for a tournament this weekend?
Yeah.
Okay. So clavicles now, even. Tip of the scapulas, we're high on the right. Okay. A little convexity or protrusion of the ribs here, and a second rib. Oh, sorry, baby.
It's tender.
I know. Okay, so what I do, well, let's do this first. Face down. Let's do something a little different. Were you the champion of the Pacific Cup in 2010?
No.
Okay. Leg lengths, good. Bend your knees. Fine. I don't know if you know anything about tennis and young kids. It's extremely demanding. Extremely, extremely, extremely demanding. These kids give up, sometimes give up how they live their normal lives to go be tennis players. Correct? Do you love it?
Yeah, I love it.
She loves it. Takes a special person, doesn't it? Mm-hmm. Yeah. Let's start here. See, there's some ribs situations here. Now, understand tennis is a one-sided sport. All the time, same side. Baseball pitching. Baseball pitchers last 4 times longer than they do, but when they get a shoulder injury, they always treat the shoulder. But they get overuse in the shoulder because they throw right-handed or left-handed, and that's all they do. So they wear out their shoulder tendons, whether biceps or rotator cuff or whatever, and they have to have these surgeries, or the elbow. But what you understand is when the pitchers hurt their shoulders, it's not just their shoulders. It's the clavicle, scapula, first and second ribs, and nobody ever treats them that I know. Yeah, maybe the Yankees have a pretty advanced program. Relax. You get the rib put in. You get these ribs here, the 4th, 5th, and 6th ribs. Oh, very nice, huh? Yeah. Okay, now sit up. Let's check it again. With your back to me. Nice hat. Okay, now, different than the first time? Oh, is it still going? Oh, here. See what you did? Okay. All right. So the first time I checked Samantha, I touched it and she jumped. So I went and treated above it and below it to see how that would affect the second rib. It doesn't hurt like it did before. So the second rib is not primary. Below that area, the ribs are primary, where the scapula or the shoulder blade attaches, because she goes down like this and it separates that scapula. So it pulls and tugs on all the rib muscles, tendons, and angles of the rib that are just inside the shoulder blade or scapula on the right side. So, you know, she's built, extra built heavy on this side because she uses it all the time, no different than a bowler, a baseball pitcher, whatever. It'd be better if she had more symmetry, so I'm asking her to do more left-handed, like I ask quarterbacks. You know, certain ones, too. Yeah. Jake Plummer is my patient. He's ambidextrous. I told him all along, both hands. Jake can throw as good left-handed as he can right-handed. Right, Jake? Then we'll get the second rib and a second rib tap. Okay? Hands behind your neck and lock your fingers, please. Now I'll use my chest. Put your elbows together, the other way, to go into, go ahead, put them together, to go into the rib right there. I'll push my chest into her right rib convexity and shift the ribs again. See, the ribs can go in different directions. You can have the ribs shift at the costosternal, you can have them shift at the vertebrocostal, and you can have the rib angles be adjusted. So it's complicated, but if you do, move your shoulder around and see how it feels. Doesn't hurt. It's perfect. Go win a tournament. God bless you.